Close to 300,000 new COVID infections have been reported in India over the last 24 hours. Let me repeat that, over 300,000 in just the last day. The death toll has risen by 4,300. It's edging the country's death toll closer to the 300,000 mark. Now, some states in India are considering extending their lockdowns and making them more severe. Meanwhile, Rise Against Hunger India says it's on the ground providing food and other emergency support to people in hospitals and at crematoriums. That's how bad the situation has gotten. Well, the organization's executive director, it's Mr. Dola Mohapatra, joining us now from Bangalore in India. Dola, hello to you. It is such a pleasure speaking to you in the middle of a pandemic. Anywhere it is difficult. But considering what is happening in India at the moment, the fact that I mentioned you are there with your organization providing support to those in hospitals and crematoriums, I think just sends home the message how desperate it is where you are.
Absolutely. Thank you, Gareth. Thank you for having me. And that is still not the full story, I must tell you, because all these crematorium, burial ground and organized way of giving last rites are visible to us. And there are many more pictures which we are not able to see or not able to capture, on camera. So I can tell you my experience in the past 3 weeks, how things are completely overwhelmed, In the hospitals, that is a common story, beds and all that, oxygen cylinder not being available. But outside, patients who are admitted or who are waiting to be admitted, their relatives, their attendants, they are for hours together, for days together, they are at the hospital, in front of the hospital. So we realize food is the last thing they will think of, Similarly, people who are going to the crematorium or burial grounds, they have to wait for 8 hours, 10 hours, to do the last rites. And even water is the last thing they will think of. So when we were thinking what way we can make some difference, we realized this is really stark, staring in front of our eyes. So we launched this ready-to-consume food packets, water bottles, snacks, in front of the hospitals, those who are waiting. And I can tell you one minor episode where we had a bit of ambush. Our staff actually got injured. So much rush was there that we couldn't control. So people were waiting for food. That's the situation.
And when it comes to the funding behind what you are doing, remembering, of course, Dola, that COVID has impacted businesses, it's impacted incomes. Yes. How are you able to do this kind of work? Talk to me about your backers.
It's very challenging. It's very challenging, Gareth. Actually, we have only today, actually, as we speak, we got our first major funder. Some funding came. Otherwise, we were using our internal resources so far. And we also did some fundraising appeal from individuals, individuals who can give $1, 500 rupees, 1,000 rupees. So that's how we have been pulling it off, Our bigger donation, as you say, from corporate world has not, first wave, last year from March to October 2020, we were able to get quite a bit of, funding support from corporate groups. But this year, from April, ever since we launched, we haven't been as successful, and it's a bit of, challenge. And this is still, as I say, we are still seeing the manifestation only in the city areas,
Dola, let me come in quickly. I want to ask you this question before I have to say goodbye to you. I mean, it's incredible the kind of work you're doing, but I have about a minute left with you. I very rarely get to speak to somebody on the ground who's not a healthcare worker. In about a minute, if you can, what has happened in India? It seemed to be on top of the problem, and it suddenly exploded. Help me understand in less than a minute.
Okay. Well, what has happened is actually, I would say, a little bit of complacency. It is not, right to say this is where we erred or this is what we did not do well. Overall, I mean, there was a bit of people were getting tired of lockdown and things not moving. So the moment the numbers went down, people, everybody, including government, public, businesses, everybody let their guard down. And as a result, and the surge was so fast, we were ready for, let's say, 5% of the overall people who might get infected, but now we are getting 20%, 40%, 30%. So the surge was unanticipated, and also, as I said, we let our guard down.
Yeah.
And there were other group gatherings, the events that I don't want to mention. Many things happened, and that was because of the collective psyche. We all thought we have now won the war.
You've won the fight, yeah. It's the COVID and lockdown complacency the rest of the world is dealing with. And I think India, just with the population that exploded, terribly sad news. Dola Mohapatra, he is from Rise Against Hunger, making a huge difference to families there during this very difficult time. I appreciate your time in speaking to us all the way from Bangalore in India. I want to